Cosmetic Surgery Laser Center of El Paso, and today we're going to be doing a rhinoplasty or a nose job. So this young lady presented, and her primary concern is the profile. So you can see the kind of the large dorsal hump, and then sort of how it dips down right here. So one of the main parts of the procedure is we're going to be shaving down the dorsum of the nose, or the bridge of the nose. Part of this is cartilage, this portion is cartilage, and this portion is bone. It is possible that we'll get to a point where I don't feel comfortable shaving down anymore, and I may have to put a small graft right here to bring this portion up to meet this portion so that the dorsum is straight. Then we'll also do some refinement of the tip, which will be narrowing, elevating, and rotating. So those are the main goals for today's surgery. We'll get started. First thing we'll do is inject with some local anesthesia, and then we'll get started with the rhinoplasty itself, and we'll be back in just a little bit. Okay, so we've started, and I've actually went ahead and made these incisions, and I've elevated the skin off of the nose. And so the first step is we're going to, and then we can begin filing. So after we do some of that, we'll come back and see some more. Okay, so we're essentially done. So I've shaved off the bony portion and taken off cartilage portion of the bridge or the dorsum. And then I've also removed some of the cartilage on the tip and put sutures to narrow the tip and also to elevate the tip. So kind of a lot of swelling already happening, but you can see the overall shape of the nose is going to be much better. One other thing I did do is I put cuts in the bones on both sides as well. I did not need to use a little graft here. After all, I felt like I got the dorsum down enough. So anyway, we'll just put some tape and a splint on, and then essentially we're done. Okay, so we're completed. One thing we didn't show last time was, so here's the finished surgery right off the table. A little bit of swelling has taken place, like I said, and then you can refer to the preoperative pictures. As you can see, really a significant reduction, especially on the dorsum itself. So I'll show you once the tape and the splint is on, and that will be it. Okay, so we're back. So I had just put on the tape and the splint, and this will stay on. I like to keep it on for about 6 days, and they'll come back to the office, and that will be removed. And then really there's not a whole lot of post-operative care after that, except for saline drops to the nose, really. Again, I'm Dr. Mark Jabor with Cosmetic Surgery Laser Center of El Paso. Thank you for watching.